Our next issue area relates to healthcare and healthcare reform priorities, and we are extremely honored to be able to have Jeff Oldham, who brings 15 years of grassroots public affairs experience to PhRMA, which is the Pharmaceutical Research Manufacturers Association. Previously, he served as a Senior Director of Operations for the Group on Affordability and Access at the PhRMA organization. In that role, he established the framework for the Partnership for Prescription Assistance. We talked about that earlier today, and the important difference that that's making in the lives of many people who are having trouble meeting some of their healthcare responsibilities. And he also has conducted outreach on numerous forward-thinking industry-wide programs in addition to PPA. In his current role, Jeff oversees a nationwide field network that works with regional government relations professionals to help position the industry favorably with state and national elected officials. In that capacity, he regularly conducts public affairs and grassroots campaigns to help in educating in the legislative process. Jeff came to PhRMA from Direct Impact Company, a leading grassroots public affairs firm where he served as a senior vice president. Before joining Direct Impact, Jeff served as a senior manager for constituent relations with the Boeing Company, where he oversees a team of 1,000 employees, retiree, and supplier grassroots activists. In the early 1990s, he served as the deputy director for field operations for U.S. term limits, deploying plans and running ballot initiatives to limit the terms of state and federal legislators. Please join me in welcoming Jeff Oldham.
Thank you, Leroy. Good afternoon, everybody. It's a pleasure to be here. Start off with a humorous story, if I may. Speaking to a nice gentleman in the back just a moment or two ago, and talking about myself, and asked him if he worked here at the Grange, and he proceeded to tell me he was the president. So I apologize, but we all have foot and mouth disease occasionally. So it's a pleasure to be here amongst you all. If you're having a great day here in Washington, D.C., it's too hot today, so welcome. But I want to start by thanking Leroy and the National Grange for inviting me here today. It's truly an honor to address the nation's oldest agricultural organization. I was looking around your website a little bit last evening and truly in awe of the work that you do in communities and the help that you provide. It's certainly what we in public service aspire to accomplish. So thank you for all you do. I'd like to tell you a little bit about PhRMA, my organization. Another funny story, a lot of people here.
We can't hear you well.
I apologize. A lot of folks here in town, when they ask me where I work and I say PhRMA, they think I work for an agricultural organization as well. I do not. I work for the Pharmaceutical Research and Manufacturers of America. We represent the country's leading research and biotechnology companies, which are devoted to inventing medicines that allow patients to live longer, healthier, and more productive lives. Pharma companies are leading the way in the search for new cures. Our members alone invested an estimated $50.3 billion in 2008 in discovering and developing new medicines. And industry-wide research and investment reached a record $65.2 billion in 2008. Our pharmaceutical research and biotechnology companies work hard to develop new medicines that help patients live longer, healthier, and more productive lives. We recognize that the advances that our scientists and researchers make every day have the potential to change and even save lives. This leads me to what I'm here to talk about today. We know that a medicine which sits on the shelf doesn't help anyone, especially patients. Because of this, we support comprehensive healthcare reform that will provide all Americans with access to quality health coverage. Recently, we released our Platform for a Healthy America, which I'll talk about in a little more detail later on in our speech, to help spread the word about the importance of health reform and share with all stakeholders our ideas about what comprehensive healthcare reform could accomplish. The Platform for Healthy America lays out our thoughts on how healthcare reform can and should expand access to health coverage while promoting affordability, value, and quality of care. Every day we partner with healthcare stakeholders, patient groups, and organizations like yourself around the country to help spread the word about the importance of achieving comprehensive health reform. It remains to be seen what shape this healthcare reform will ultimately take, but we are working hard to ensure that it's in the best interest of patients everywhere. Now, in politics, like history, it's important to study the past, I believe, before dissecting what might happen in the future. I'm sure many of you can remember, I was only 5 years old at the time, but in 1993, the battle over Hillary Care, or healthcare reform as it was called. I'd like to look back on that a little bit today, compare what's going on currently in our political landscape with what was happening then. I think there's a lot of synergies and similarities. Feel free to ask me questions along the way if you have them. But politically, 2009 and 1993 will share some similarities. We have a new Democratic president, takes over after years of Republicans in the White House. The new president will be able to work with Congress firmly in Democratic control. Now, both President Barack Obama and then President Bill Clinton entered office during difficult economic times. And as candidates, both made healthcare reform the top issue in their successful campaigns. 2009 is different, though, in certain ways from 1993 in many ways. Specifically in the healthcare reform and the political environments that surround them. In 1993, then President Clinton, as you recall, tapped his wife, then First Lady Hillary Clinton, to take the lead. Now, some have speculated, and I add that this is not my personal view on politics, but sort of a 30,000-foot observation, that her insular and heavy-handed approach at that time helped doom that effort. I think anyone in this room would disagree that they made some missteps along the way. But she had lots of help. She wasn't alone. There was Congress, there was interest groups and the like lobbying against her. There was broad disagreement about the nature of the problem specifically, let alone the solution. Interest groups fought the Clinton administration reforms vigorously and effectively, I might add. Given the lack of consensus and clumsy politics, its inevitable defeat, in retrospect, was going to happen. Now, the number of mistakes made by the Clinton administration in pushing for healthcare reform in 1993 are certainly numerous. As I mentioned, their heavy-handed approach, instead of engaging lawmakers from the beginning, the task force led by Hillary Clinton closed the doors. Democratic members who were key in getting legislation passed were pushed out of the loop and expected, I assume, to fall in line with their Democratic president because, well, he was the Democratic president and they're supposed to do what he says. Now, leaving aside the fact that not everyone was enamored with this particular plan, some might perceive that as political malpractice. Because it's very important to remember this. The president can propose, but Congress enacts legislation. And without that Congress on your side, it's very difficult to get things passed, especially something as personal as healthcare in Washington, D.C. Now, some of the opposition that was generated was sincere. It was based on differences of opinion concerning policy. Some of them emerged from economic or political agendas threatened by the changes. In either event, it's important to have a strong base with a unified message to withstand the inevitable attacks that will come with any policy change from Washington. Now, the Clinton administration's approach to imposing their viewpoint on Congress meant they had few supporters when and where they needed it most. The result was political rout, and it helped open the door for the Republicans retaking Congress in 1994. Now, certainly healthcare wasn't the only reason for that, but it was a big reason. Now, let's move forward to 2009. The political environment, while there are some similarities, there are also differences. That there's a crisis in America's healthcare system is broadly accepted. Growing medical costs, the ever-increasing health insurance premiums that they cause, are harming financial security of families and the economic viability of companies. Obviously, we've heard a lot in the news recently about companies like General Motors and Chrysler. A lot of their economic struggles came from healthcare costs that they provide to their employees. Tolerance for a large number of uninsured in this country is near nil. Whether based on temperament or wisdom earned at the Clinton presidency's expense, President Barack Obama and his team are approaching healthcare reform in a far different manner. Their outreach to Congress has been, quite frankly, extraordinary, and I say that as a conservative Republican. They've done a masterful job. They're not only working with congressional leaders to design the plan, but are helping to create a unified message.